Okay, so hi everyone. I am going to invite Dr. Badawi on, and we're going to start talking about laser hair removal and any questions that anybody might have. Hi, Judy. In regards to laser hair removal, and just looking here. Just waiting for Dr. Badawi to join. So if you have any questions, start getting them in because we're going to be happy to answer them for you. Okay. Just waiting for Dr. Badawi. Successfully sent. Oh! View. Here he comes.
Hello.
Thanks, Judy. Hi, how are you?
Hi, Amy. How are you?
I'm good, thank you. It's a successful day in the clinic today.
Yeah, it was busy.
It's very busy.
Excellent.
Yeah.
Good.
Yeah.
Are you complaining or are you happy?
I'm happy.
Excellent.
Never complain about being busy, ever.
Exactly. Perfect.
Not when you're doing what you love to do.
Yeah, exactly. Actually, unless you are enjoying what you are doing, you can never be creative. So it's always fun to do what you enjoy.
I agree. And I find that as long as we have our safe space to be creative, that gives us that ability to be creative. So
yeah, I think.
Oh.
Yes, I'm just trying to do the increase the volume. So I think that's okay now. So I think this is important because many people are very much worried about resuming the activities, going to the spas and the clinics and so on. However, I think as long as we are taking the right precautions, everything is going to be okay. Actually, I would go a step further. Our places where we practice are safer than other places because we are concerned about the health, about transmission of the virus. So we are taking even extra precautions than any other place. I believe everyone is going to.
I agree. I completely agree. And it just kind of reminds us, right, to just be aware of our surroundings and don't rush. Make sure you clean up after yourself and just comfort for everybody, right?
Exactly.
Yeah. Excellent. Okay, so I'm excited about this talk because one of my jokes is always that I seem to be everybody's last resort for everything, skincare, hair removal, and I kind of love that challenge because when it's the last resort, it's the resort that works. It takes you until you get frustrated enough, right? And then you find what works. However, on that note, I do find that whenever I have clients that have had hair removal, am I getting feedback there? I'm not sure.
I think you are having two mics, Amy. There are two devices. Is it computer and phone or two phones?
Yes, I do.
Yes. Sometimes when you have two mics, then one of them is causing echo.
Okay. Is that better?
Yeah, I think so. Otherwise, we can reduce the volume a little bit. I don't know. People who are attending, is the voice okay, or is there any problems?
Yeah. If anybody can just let us know if the voice is okay. I think that's a bit better now.
Yeah, I think it's better.
Okay, so anyways, Better? Okay. So what I'm finding is that if I have clients that come to me and they had laser hair removal before they came to see me with different devices, then we have issues. And a lot of times it's paradoxical hair growth that I find, or they've experienced reduction, but then it's come back and it's a lot finer and it's much less of a target, or they've been told that the hair removal is going to be completely gone. Like there's just a lot of misconceptions that clients are being told all over the place. And I felt that it would be a good opportunity to really kind of dive into, for customers, not so much for the professionals. I mean, professionals are going to learn something with this as well, but for customers, really what the expectation should be from two experts in the field.
Okay. Yeah, I think it is really very important to understand, all the aspects of hair removal and expectations, because it's one of the most popular laser applications. It's one of the oldest applications. And still, when we used to go to conferences, a large number of talks and sessions are about that. Whenever we open any laser journal, again, we find a lot of articles about laser-assisted hair removal. So it seems that there is something we can learn every day, and there are things which we are still lacking. The problem is that in order to be effective, sometimes we are not safe. And in order to be safe, sometimes you are not effective. So to find the thin line between effectiveness and safety is very important. And being able to find that thin line depends on how much effort did we exert in order to learn. And this is something I really appreciate about you, because even though you have been in that field for a long time, you are always asking questions, you are trying to attend conferences, you are attending the teaching courses and so on. So this is something I really appreciate about you, Amy.
Thank you.
Now,
thank you.
We have also to know that there are so many devices in the market. There are so many practitioners in the market, and not all of them are at the same level. And when we are using the laser to improve the hair, to reduce the hair, number one, we have to understand what to expect. Number two, we have to understand that the results are variable from one person to another, and in the same person, from one body location to another body location, right? We cannot compare face and head.
Yeah, I just want to interrupt there, because I really want to stress that point as well, because I have, you have two women friends that are on a walk together, and one's saying, oh, I had this result, and then the friend expects to have the exact same result, and it's two different bodies.
Yes, exactly. So we cannot, even in the same body, Amy, the face and the neck responds completely differently than the lower legs, for example, right? So we cannot compare, the body parts with each other.
Yeah.
On the other hand, the darker the skin, the more challenging it is. The darker the skin, or the more tanned the skin is, we have to be careful, because if we use the right energy and the right parameters, we can damage the skin as well, because we are trying to affect the melanin, with the pigment in the hair, so that the pigment absorbs the laser and converts it into heat and damage the hair follicle. However, this pigment is also present in the skin. So we have to find the right balance to avoid any negative impact on the skin, and have the full impact as much as we can on the hair follicle, which is sometimes not. The laser is a magical beam of light, which is having certain characters which allow it to be more specific. And when we are using the laser for hair removal, we are depending on a theory called selective photothermolysis, where we are using that beam of light to selectively damage a target, a structure in the skin, with preserving the other structures around that, right? So this is called selective photothermolysis. To achieve that, we need certain energy, we need certain pulse duration, we need certain wavelengths of laser, and so on. However, if we used too conservative parameters, then instead of getting the selective photothermolysis and reduction of heat of the hair, then we get a stimulation. So the heat, which is at lower levels, is going to stimulate the local blood circulation and increase the perfusion of the blood to the hair, to the area, including the hair follicles, so the hair might grow more. And this is called paradoxical hair growth. So if you use too conservative parameters, or longer pulse duration than required, or certain wavelengths where it is not going to be effective, it can increase the hair instead of reducing the hair. I'm not saying that we are supposed to be using aggressive parameters, because if you use aggressive parameters, then the incidence of complications and skin burns and pigmentary problems will be more. And that's why it's very important to find the right parameters for the right client. And this is, by the way, as you know, it is not constant. So if a client comes to you today, you are using certain parameters, and then you write down in the file what you use. The most common mistake I have seen is that people are using this information every single visit. When the clients come after 4 weeks or 6 weeks or whatever it is, they open the file, they look at the parameters, and they use it again. It is not correct, because when the hair is becoming thinner, there are different settings which are required. When the patient is coming back, or the client is coming back from summer vacation with tanned skin, then there are another parameters, and so on. So we have to be dynamic according to the changes happening in the skin to be safe and effective. So this is really very important to understand. It's not a matter of I want to go to the cheapest place performing hair removal. It's very important to be in safe hands with people who are well trained, well educated, in order to get good results. It's not a matter of just getting rid of the hair. I know people who are going to some spas and clinic every month for hair removal, and this continues for years. It is useless. I mean, if we do wax, it's going to be once per month and for years. Laser is supposed to be much more effective than that. Yeah, exactly.
Exactly, and a lot less expensive. Yeah, exactly. And I think too that so you know, a couple of points on that.
Of course.
Is the quality of the machine as well, right? So I keep thinking I've got feedback. I hope I don't have feedback still. So if the machine's being maintained, if like the quality of the machine. So as I say, you know, we have two different machines. Like I have the Photona, and then the Soprano is another one. They're two different qualities and two different energies, even though it's the same platform.
Look, Amy, as I mentioned in the first point, it's very important to know how to play with the parameters, how to change the parameters. This is regarding our knowledge. However, on the other hand, the machine should be also flexible. The diode technology is not providing that. So when we have a diode system, whether it's 1060 or 810 or whatever it is, it does not allow controlling each parameter independently. We know for a fact that when the hair is becoming finer and thinner, you have to reduce the pulse duration and you have to increase the energy, right? So this is something we can do with the Nd:YAG, we can do it with the alexandrite, we can do it now with even some of the IPL systems, but unfortunately with the diode, this is not an option. We cannot do that. If you reduce the pulse duration because the hair is becoming thinner, automatically the fluence will go down, whereas we need to increase the fluence. If you increase the fluence because the hair is becoming thinner, automatically the pulse duration will go up, which we don't want. We want it to be reduced. And that's why the diode is an excellent device when the hair is thick for large areas. It has very nice capability to affect the thick hair. However, when it comes to the finer hair, which is a phase we are going to see anyway, it is not going to be effective, and then we have to refer the patient to another machine which is having this capability. That's why we cannot say the diode is good, the Nd:YAG is bad. In good hands with good quality of a system, will be able to know what to pick, and definitely the quality of the system is very important. If I have an IPL system which costs $10,000 or $15,000, it's never going to be as safe and as effective as another system which costs more than $100,000, right? It doesn't work.
Yeah. That and as I said too, I find
definitely this is very important. I totally agree with you, because if the machine is well maintained, then we can ensure that the performance is stable. It doesn't have any issues. And I have seen many colleagues who are complaining of problems happening to the patients simply because the optics are damaged, because the debris of the hair is reflecting on the filters and the lenses, and the practitioner is not taking care, and the filters are not changed in the appropriate time. So it causes hot spots on the skin, and it causes burns. In other issues also, if that happens and the machine is not calibrated well, it can overshoot. So it can deliver higher energy than required. And also it can damage big parts of the machine. So it's going to be costing a lot to maintain. And that's why it's important to have a maintenance contract. It's very important to have the machine well maintained to ensure smooth running of the practice and safe also running of the practice.
Which I find is really important for clients to know, just because you hear all the time, well, this was, why is it so much more expensive here than it is somewhere else? And that price, you have to really kind of be transparent about price as well, that if someone's paying for the machine to be maintained, then that's going, it's for your safety and for the end result to be the best that we can.
Of course, when you are setting a price list for the services you provide, it is based on your so many things, what you are using of machines, of products, the service you provide, how much you are spending time with your clients to educate the clients, to let them know what to expect. And so on. So there are so many things. The service I provide has a certain value and price, and this is different than another colleague who's using another machine in another facility with different stuff than I'm the ones I'm using. So there are so many aspects, and people who are searching for the cheap stuff, definitely they are not going to get the same quality of service.
Yeah. Okay. So I have another question, because these are always, the issues that I run into. Having the client's expectations around how much hair reduction should they expect. Now, one of the things that I try to describe to them is that when we start to get less and less hair, right? You're not going to have as much bulk. And so without the bulk, it's almost like a needle, the laser's trying to find a needle in a haystack. So if you've got, sporadic hair here and there, the laser doesn't necessarily see it as well as it would if it was, amongst a bunch of hair. So just because you see a hair that's in, in an area, does not mean that the laser is going to see it.
No.
So those are the hairs that we have left behind that we're probably not.
Number one, let us go a little bit back to the history. When we started the laser-assisted hair removal process, and this was in the 80s, so a long time back. At that time, the FDA granted approval for laser-assisted hair removal. And after a while, they discovered that it is not called hair removal because the hair is not going to be removed. The hair is going to be reduced. So they changed the approval to laser assisted hair reduction. Reduction means reduction in the number and in the thickness, and also more delay in the regrowth. This is what we expect. And as I said in the beginning, the realistic expectations must be there. If someone is having unrealistic expectations, they are going to be frustrated. So it's very important to let them know and educate them as you do that what we expect out of those sessions. So we expect a reduction of about 70–80%. Of course, it's different from one body part to another body part. Lower legs, for example, responds much better than the face. Face and neck is the least responsive. So we expect a reduction of about 70–80% after a number of sessions, which are different from one person to another. Maybe 4 sessions, maybe 20 sessions, it depends. But after that number of sessions, we need to maintain the sessions. In order to maintain the results, we need to repeat the sessions every 3 months, every 4 months, every 6 months. It depends from one person to another about regarding the depending on the rate of hair regrowth. Now, it's very important also to understand that the thicker the hair, the more responsive it is to laser. Because when the hair is thick, it absorbs the laser in a much better way than if the hair is thin. If we have hair, but that hair is blonde, it doesn't have color, it is never going to be responsive to the laser because there is no chromophore. There is nothing to absorb the laser energy, right? And that's why white hair and blonde hair does not respond. When we have someone who's having fine villous hair in the face, we tell them, no, this is not going to be responsive. Laser is not a good solution for you. So it's very important, again, to pick the right device for the right patient. When the hair is becoming sparse and when it becomes with less density, then one of two things. Either it has enough chromophores, so the hair is thick, it has color, it is black or brown, so it's definitely going to respond. But the sensation of the pulses and the laser will be much less than if the hair is more dense, because when the hair is more dense, each hair follicle is going to generate certain amount of heat, and the cumulative heat is going to be felt more. If the hairs are sporadic, then each hair is going to generate some heat around, but it's not going to be enough cumulative heat so that they feel the heat. So they might feel that there is nothing. However, if the hair is having enough color, enough pigment, and if the parameter is used correctly, it is going to be very effective. When the hair is becoming thinner, then it is a problem because the absorption is going to be less and we have to be a little bit more aggressive. Does that answer your question? Okay.
Yes. Okay. It does, definitely.
Actually, this is a very important point.
As women, we want to be like completely
hair-free.
Actually,
let me stress on that important point,
so
because many people would like to be hair-free. Someone is just writing that I need to, they want me to speak in Arabic, so let me just tell them that مساء الخير. هو الحلقة دي بالإنجليزي، بس في حلقات تانية هعملها بالعربي إن شاء الله هعلن عنها، إنما المرة دي بالإنجليزي. I was just explaining that this broadcast is in English because some patients are joining and they want me to speak in Arabic. So I told them that the Arabic broadcast is going to be announced later.
Yeah.
So back to the point which you said, you want to be hair-free. This is the dream of everyone. And about 30 years ago, someone was telling me, I dream to have a machine where people will go from one side and will get from other side without hair. But actually, it is still a dream, and I don't recommend it. We have to understand that the way the laser works on the hair follicles and reducing the hair is by affecting the stem cells. The stem cells are the cells responsible for the regrowth of the hair follicles and also our skin cells. So, and the theory of using the laser for hair reduction was was suggesting that the laser will damage the stem cells, so the hair will not regrow. I believe that we are so lucky that we are unable to do that. Because if we had the means to damage all the stem cells so that the hair follicles are completely damaged, then it is not going to be regrown. Then this would impair the healing capacity of the skin. If we have the means and the way to get rid of the hairs completely, then if that person had a wound, the healing would be very slow because there are no stem cells. So actually, we are lucky, and our clients and our patients should feel lucky that we are unable to get rid of the hair completely. So they should be thankful.
I agree. Okay, so there was a question.
Okay, good question. It's a very popular one.
Age,
and usually I face that question when I have parents bringing their 8-year-old daughter because she has hypertrichosis, so she has a lot of hair on the face, on her body, and so on. In general, I prefer to postpone beginning the laser-assisted hair removal for 1 or 2 years after puberty, because when the hormones kick in, then the hair is going to be reduced a bit. So this is the ideal case scenario. Having said that, it's important to know that laser is safe at any age. Sometimes we have babies who are born with vascular tumors or vascular malformations, and now the protocol is to start to treat them on diagnosis. So even if they are a few days old, we can start the laser. So the laser doesn't have a limit of age to be used. However, I'm always concerned about the psychological impact. If I have a girl who's 8 or 9 years old and I try to do hair removal for her, and she's not, aware or mature enough, she's going to feel the laser pulses, which is a kind of pain. She's going to be frightened. She's going to cry, and this is something I consider as psychological trauma. On the other hand, I would like to avoid the psychological trauma from the bullying, because at that age, the kids sometimes are very, very mean, and they will comment, and this is going to affect this child or this girl psychologically. So what I would suggest is that the areas which are obvious in the face or in the hands, we can do it with the least possible pain. So, for example, in your device, we can use the Nd:YAG with the FRAC 3, the 1.6 millisecond, with very low fluence, 10 or 15, which is going to be considered as very low pain-inducing session. And then we can get rid of the hair in the exposed areas. And we keep the areas which are less exposed till she gets puberty. We wait for 1 or 2 years, and then we go for the larger areas, so that we have the good balance between the pain and the psychological issues of the hypertrichosis.
Yeah, perfect. I agree. And another quick question or comment, when it comes to the pain, because we have a lot of companies that are telling us that we have pain-free hair removal, and again, clients expect it to be pain-free, but then have success. And I try to tell them that that's not really the case. We want to have more of the production.
There are some,
you're going to feel it
of
because
course,
we're
I
burning
agree, because
hair.
there are so many devices in the market which are used, and they promote that pain-free hair removal. This might give some remission for the hair growth, but then it's not going to be associated with reduction. An example for that is the Q-switched Nd:YAG. We can use the Q-switched Nd:YAG, which you have as well, for shaving of the hair, while bleaching the hair, and the hair is going to fall off but then it is going to be growing back with the same intensity, with the same number. So this is not associated with hair reduction. So most of the systems which are associated with no pain or pain-free, the percentage of reduction is going to be very limited, and the regrowth is going to be almost complete.
Yeah. So I think that's a really important thing for consumers to understand, because they're surprised when it hurts, and it's it's there. That's the misconception, right?
However,
There's no such thing as hair pain-free hair
which we do
removal
and you
with
do
the laser.
in order to have minimal
you're bound to feel it.
Like, for example, to reduce the fluence when the hair is thick, because the absorption is going to be good, using the flat-free, and so on. Someone is asking which device you are using. So they are asking what device are you using, and I know it's the Photona, SP Dynamis, which is having yeah. Okay, so this is regarding the pain, and also we my favorite as well. Also, we have to know that when the hair is becoming thinner,
it's my favorite.
Then the pain is going to be less. We'll be increasing the fluence. We are going to be reducing the pulse duration, but the pain is going to be less, because the thicker the hair, the more it absorbs the laser, and the thinner the hair, less it absorbs the laser. So the pain is going to be reduced with the subsequent sessions.
Exactly. And that was actually because it was what, like a year ago or something, that we kind of developed a little trick with the Photona that I've been using that has been very successful in getting nice and deep, not as much pain, but we're getting successful reduction of the thickness. And then we can start to tackle it with less pain for sure. Okay, another question. So I have a client who's redhead, and she keeps saying to me, still nothing for redheads, eh? So here's the thing that I was, playing around in my mind, because I know that redheads have very thick and coarse hair, and we might be able to get a little bit absorption, a little bit, not the same, like it's a little bit more than like a blonde, right? That would be enough to thin the hair, so that when they actually do get waxed, it will be easier for them. What are your thoughts on that?
There are two things.
This
Number
was just
one,
something that came to my mind the other day when it was being asked.
The type of melanin is affecting the absorption. So when we have the people with red hair, the absorption is much less than if it is black or brown. So we have to understand, and we have to discuss that with the patients, that the expectations are completely different than if you are treating someone who is having black or brown hair. The response is less. We have to use a bit more fluence, shorter pulse duration, sometimes combination of different wavelengths if we have other wavelengths, and so on. However, on the other hand, the point which you mentioned, which is waxing and then asking the patient to come, is a very valid point, because we know that the hair will affect the laser while it is in the anagen phase, which is the early growth phase of the hair. So if we wax the area, so if I'm treating my hand, then, and we have hair in all my hand here, only 30% of those hairs will be in the anagen phase. So I'm targeting only 30%. If I wax this area and wait for the hair to regrow in the beginning of the regrowth, then everything is going to be in the anagen. So instead of targeting only 30%, I'm targeting 100% of that hair. So this is a new concept which has not been there for long. And now we started in the challenging cases to ask the patients to wax the hair. And then when the hair is starting to regrow, they come to do a session, and then the session is much more effective than before.
Okay, I'm laughing because I think I said
You know,
that.
15,
Like, wouldn't
20
it
years
make
ago
sense
when
if
we
we
started,
waxed it?
we used to tell
So
the
I'm
patient
happy to
it is
hear that that's what's
contraindicated to
happening.
wax or plug the hair in between
That's
the
a lot of
sessions
fun.
because we're
Okay.
saying that it is important to have the hair follicle. However, with some more research, we found out that if they wax, but then they have to wait till the hair regrows. This is when they should come. If they come and the hair did not regrow yet, then there is no target for the laser. So it's very important
Yes.
to wait for the regrowth.
Yeah. Well, and it's also very, because from my past life when I was waxing, it's very important to have someone who does a very good
definitely.
wax
Yeah,
job.
sure.
Because if they're breaking the hair, then why bother? Right?
Yes.
So
yes.
you want to make sure
totally
you're sourcing out your waxer very well, for sure. Excellent. Yeah. So I don't know. Do you think there's any other questions
I got a couple of questions.
People would
They
have
asked
in
me
regards to this?
talk about the difference between the laser and the IPL.
I think we covered quite a bit.
So IPL are devices which are available and they are used for many applications. One of them is hair removal. Also, they work on superficial pigmentation, superficial vascular lesions. The difference between the laser and the IPL is that the laser is having certain characters which allow the pulses to be very reproducible with the same characters. So each pulse is going to have the same characters of the other pulses. So this is giving us a good way of standardization. With IPL, this is not the case. Each pulses might be a little bit different, so we can get different effects with the same parameters we are using. The second character or the second difference is that the laser is collimated, so it can penetrate deep into the skin. So even when the hair follicles are deep, or if we have dermal deep pigmentation, the laser can go that deep. With the IPL, it cannot penetrate deep. So if we are treating an area with hair follicles which are deep, then the recurrence rate is going to be much higher than the laser, because the laser can penetrate to affect the hair follicles, the IPL cannot. But on the other hand, the IPL is usually having a larger spot size, and it is less expensive than the laser as a machine. It has less expense in the running costs, so we can offer a total body hair removal session with a less price than the laser. However, the quality is definitely not going to be the same, and you will need the laser anyway in areas where the hair follicles are deep. So this is the difference between the laser and the IPL. I'm not saying that the IPL doesn't have a room. I'm just saying that we have to understand the difference to have realistic and correct expectations.
Yeah, and I'm so glad that you brought that up too, because again, you can't paint all the services with one brush, and you really need to figure out, is it, I mean, a lot of clients, when they come to me, they say they had laser,
very common thing,
but then I find out that they had
very
IPL,
different, and the expectations are different as well.
Not laser. So it's very different. Yeah. So there was another question there that a client is having paradoxal hair growth.
Of course,
and
because
has had 8 sessions,
we have to.
And she's wondering if the Fotona is still a good option for her.
Of this paradoxal hair growth. Is it the machine? Is it the practitioners? Is it the parameters? But definitely, if you have a good machine and you are able to play with the parameters to adapt it to the thickness of the hair, the area of the body, the color of the skin, safely and effectively, then definitely there is a lot of improvement we can achieve. Having said that, it's very important to exclude any underlying pathology. So if she's having any hormonal issues, any hormonal disturbances, or polycystic ovary, then this has to be treated in parallel to the laser treatment. We have to go hand in hand. We cannot use the laser without the medical treatment. We cannot use the medical treatment without the laser. It has to go parallel.
So, and this is, it makes me think of one of my clients that we're having this issue with, and the areas where she's having the difficulty is actually on her arms and her upper
There are
legs.
areas which
So
are hormone dependent, and the areas you described are one of those. So I would definitely look for any problems with the polycystic ovarian disease or any hormonal disturbances. One of the hormones which are really associated with severe resistance for hair removal is the prolactin, the serum prolactin. When the serum prolactin is high, then we get no results, almost no results with the laser assist hair removal, and that's why it is contraindicated to do hair removal during the lactation, because the prolactin is high and then the response to the laser is going to be very weak. Yeah. I was always looking at the books and the manuals of the machines and wonder why the lactation is a contraindication. I was saying this is nonsense, and it is, but then when I looked at it, I found it makes sense, because the high level of prolactin will prevent the laser assist hair removal or decrease the effect significantly.
Yeah, and so a question about that too, then, if they have high levels of prolactin, then they would have more tendency to hyperpigment as well with the heat on their face, correct? That could be, yeah. Excellent.
This is Dr. Lamia. Dr. Lamia, how are you? Yes,
did you see that question there?
Of course, laser hair removal help? Laser hair removal in the axilla and in the groin, in the bikini area, is a partial treatment for hidradenitis, and maybe it's not going to get rid of that completely. However, it can help, because we know that the hair growth is affecting the pathogenesis of the disease, of the problem, and laser hair removal is one of the tools we have in order to treat that condition. Another question which I got, Amy, is regarding the developing white hair after hair removal. So some people will come back after a few sessions and tell you that I developed white hair. I didn't have white hair. After your sessions, I got that. So it is one of two scenarios. The most popular and the most common is that they already have white hair. Usually it is in the chin or in the face, but it is covered by black hair. And we don't pay attention to that, or they don't pay attention to that. We start the sessions of the laser, and the laser is going to be affecting the black hair. It will not touch the white hair, because the white hair doesn't have chromophore. So we get rid of the black hair, we reduce it significantly, but the white hair will remain as it is, unchanged, because it is not affected by laser. So they will start to observe it. So they will come claim that they develop that white hair after the hair removal. And that's why it's very important to examine the patients before we start. And if they have white hair, we have to highlight this point, that the white hair will not be affected by the laser. Until today, the only solution for white hair is the electrolysis. The laser is not going to affect the white hair at all. Sometimes they know that they have white hair, but they will not tell you. You have to tell them. Or sometimes they don't pay attention, and in this case, you have to let them know that the white hair is not going to be affected. So this is one scenario. What about the other scenario? The other scenario is that we have a client who is, in the age group which is potentially will develop white hair soon. So maybe in the 50s, maybe in the late 40s, something like that. So they have still black hair. If we use conservative parameters in this individual, where we are using a little bit less fluence than required, or a little bit longer pulse duration than required, just to be safe. In this case, the heat generated by the laser pulse might damage the melanin in the hair follicle, but without enough heat and damage to the hair follicle itself. So we can convert black hair into a white hair. So this is something we can induce if we use two conservative fluents in the susceptible age group. So if you have someone in the late 40s or in the 50s, even if they have black hair, don't use conservative fluents. We have to use the right parameters according to the skin type and the hair thickness, and protect the skin by using good cooling, not by using less fluents or longer pulse duration. This is going to avoid developing white hair.
Yeah. 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 Great point. Exactly. Excellent. I don't know if I'm trying to think of any other questions. I think another point that I would like to point out as well is when we were talking about the kids or the younger clients that come in, when we treat them, then we usually, I've had a couple of clients that have had treatment failure with them, where the hair just keeps coming back. So again, that's just there's just too much energy in the follicle at that point. Like I explained to them,
this
that,
is one point. What you mentioned is one point, but another very important point, Amy, is that
right? So
with kids we are a bit more conservative. We don't want to be harsh, so you are using less fluents, so they are not feeling the pain, they are not crying, and so on. And when we are a bit conservative, using less energy and longer pulse duration, then we are not going to be as effective as required. So this is also playing an important role. And we tell them that's okay. When they are growing a little bit older, when they are more mature, we are able to use more aggressive parameters, so it's going to be more effective. And as I said before, 1 to 2 years after puberty, things will be much better.
Yeah, exactly. It's just, I think it's a really important point for both of us to kind of shout out there, because I know parents want their kids to, they want to just, let's not wax, let's just get you lasered.
I agree.
But it's true. It's just a waste of time a lot of times.
This is something which I don't encourage at early age, for sure.
And especially if it's full
one
body.
of the important things which also has been sent to me as a question is people who are having hair removal, usually it is in the face, and then they develop acne rash, acne-like rash or something like that. And this is happening in darker skin types, 3 and 4. People who are having acne-prone skin, sometimes they develop that reaction.
Yeah.
And this is as foreign body reaction, because when we use the laser to damage the hair follicle turns into a foreign body, because this is denatured protein. So the immune system is going to react to that damaged protein and foreign body, and this is going to be, it's not infection, it is a foreign body reaction. So in this case, we can use weak steroid, hydrocortisone 1%, which is OTC. It is in the shoppers or any pharmacy, and this can be used twice per day for 3 days after the procedure, and by the subsequent sessions, it's going to happen, but every time is going to be less than before. So just reassure the patient, it's not infections, it's an immune reaction to the damaged hair follicle, and usually it's going to subside.
Yeah. Yeah, so I would describe that to my clients as it's like sediment, right? So
exactly.
It's anything that dies within the skin needs to purge out,
exactly.
needs to release it, right? So it's a type of exfoliation that you do. Yeah, exactly. So actually that reminded me of one more point that I was thinking of. So a question that I started to ask my clients when we're starting the laser hair removal is how much stress they're under. Because when we have a chronic stress or an acute stress, then the body will actually take activity away from hair follicle, skin, any area of the body that has a lot of activity, right? Cellular activity, so that it can deal with the stress. So the hair will actually go into telogen phase. So we're really treating a lot less.
What I can tell you is that
the
amount of
Would you agree with that?
knowledge we have is much less than what we don't have. We don't know. So there are so many areas in the human body which we did not explore yet. So maybe you're right. I don't know. I don't have specific information about this. But what I can tell you and everyone attending is that the stress is having a very negative impact on everything in the body, starting from the immune system to the mood, to the blood pressure, to the metabolism in the body. There are so many things which are damaged by the stress. So yes, is the hair going to be less responsive when people are stressed? Maybe. With the stress, we get adrenaline. Adrenaline is going to cause vasoconstriction in the periphery. So this might affect how the hair is affected by the laser. So there are so many theories. There are so many details which I'm sure if we dig into, we are going to find many causes why the stress would impair so many things which would go much smoother without the stress. Yeah, yeah, exactly. There was someone asking about if we can
hair
wax
removal and
in between
everything
the laser hair removal sessions, and I think we can wax in between the sessions. However, we cannot do the next session unless we start to have regrowth of hair. So I cannot wax and then just go to the clinic. I have to have the hair follicle, which is the target for the laser. If I wax in between the sessions, then we have to wait till the regrowth of the hair. And this is a good strategy if we want to get a better results. However, if you wax once before we start the sessions of the laser, then the hair is going to be in the anagen. We do the session of the laser and then we wait for the regrowth, and then everything is going to be growing back in the anagen. So it's not going to add much to wax in between the sessions. It's important to wax before I start the sessions of hair removal.
Yeah,
it depends
so
on the rate.
So
on the
a
rate
couple
of
weeks
hair
at
growth,
least
because
before
some areas in the body will have much faster growth rate of the hair. Some others will have much slower. So how long before, it depends on the hair growth. The important thing is that on the day of appointment, I need to see the hair 1 millimeter above the surface of the skin so that I can adjust correctly to get the right parameters for that hair and that skin. Okay. So did we answer all the questions we received here? Are you checking the questions?
Excellent.
Okay. I'm not following the question, but if
I'm not sure if you have any more questions.
Screen quickly if there is any question we did not answer. I
think so. I'm sorry? Yeah, I think that it would induce. So there was another question.
Yeah, I answered that question.
The hidradenitis in the groin area.
Of course. Whether it's in the axilla or in the groin, yes, of course, we can use the laser hair removal, and the Nd:YAG would be the best because the Nd:YAG has the deepest penetration. So it's going to be even more effective than any other type of laser to be used for hair removal.
So there's another one. This means that in systemic diseases, there is precaution for laser hair removal.
Actually,
hypothyroidism, anemia, or even cancer.
It depends. I mean, we cannot just generalize. With systemic diseases, we cannot do laser, or with systemic diseases, it's safe to do laser. It's important to know what disease are we talking about, which medications we are talking about. Some medications might cause some side effects like the isotretinoin, the Accutane, which is causing dryness of the skin. So if we are using the laser, we have to make sure that the skin is well hydrated so that it doesn't cause burn. Some medications like the Accutane can cause photosensitivity. So if you are doing an ablative procedure, then we should instruct the patient correctly to avoid sun exposure or use sunscreen and so on. So it depends. We cannot just generalize. There are some diseases, skin diseases like psoriasis or vitiligo, which might be associated with something called Koebner phenomena. Koebner phenomena means that they develop new lesions on trauma. So when the skin is traumatized, a new lesion is going to develop. And this is called Koebner phenomena. So Koebner phenomena is one of the contraindications for laser because the laser is going to be considered as trauma. So we do hair removal and then those areas will develop the disease. So that's why we have to get good history from the patient, from the client. And if they have this Koebner phenomena, then it is a contraindication. Regarding the anemia is never a contraindication for laser.
Yeah.
And hypo or hyperthyroidism also is not a contraindication for the laser. We just need to know what medications they are taking because some medications will have an effect of photosensitivity. So we have to be selective what type of laser to use with those medications and so on.
Okay. And so with the other phenomenon that you were just mentioning, so that would be even with shingles, right? Because if you had shingles in the area, then the laser, the heat from the laser could actually trigger the shingle.
Any active or recurrent viral infection.
Would you agree with that?
Has to be dealt with care. And sometimes people who are getting repeated attacks of herpes, we need to use antiviral treatment 2 days before and 2 days after the laser. So of course, each problem is having certain precautions, and that's why it's very important to take good history from the client, from the patient before we start.
Excellent. Okay, well, I think that we've got all of those questions covered, and I'm so sorry. Like I had feedback tonight, so
that's okay.
It's hard for me to because I keep hearing the feedback. So I don't know why that's happening, but yeah, this was awesome. I'm so glad that we had this opportunity to jump on this and answer some questions for some clients.
Next time we can talk about rejuvenation.
And
but
in the
maybe
we'll be talking rejuvenation next time, but we'll definitely do another one.
It's a bigger thing. If we didn't answer any questions,
I agree.
Let them please post it under the video.
Topic.
I'm sure that you are going to save it and it's going to be there. And I'll be very happy to answer any questions they might have. Okay?
Yes, it's going to be amazing. Yeah, I'm going to be posting it on the Smooth page, so it'll be there for everybody.
It was a pleasure
and if you have any more questions,
you, Amy, and to answer the questions of everyone.
So happy to answer it for you. Excellent.
Okay, thank you.
Okay.
Have a nice evening.
Much love.
Thank you. Bye-bye.
Always.
Bye. Bye-bye.
Always.